Professionals.
Righty. Today's podcast guest is the owner of Living Fit, a physical therapist, strength and conditioning coach, wife, mom, and friend, and has spent most of her life studying and appreciating human movement. She received her Bachelor of Science in Exercise Physiology and a doctorate of physical therapy from the University of Massachusetts Lowell. She started her career in the traditional healthcare system, focusing on treating medical diagnosis and symptoms. As a physical therapist, she has worked in the inpatient rehab and outpatient settings and has taught group fitness classes and done one-on-one training for nearly a decade as a strength and conditioning coach. She's excited to now have her own mobile physical therapy and wellness practice outside of the traditional healthcare model to help people make progress toward their movement and fitness goals. She hopes to inspire those around her to make healthy choices so they feel good in their bodies. Welcome to the podcast, Dr. Jessica Carey.
Intro.
Oh, I get a friend that's a doctor. Isn't that cool?
Yeah, that's pretty badass.
When I found out Jess was a doctor, I was like, wait.
The
what?
only person I make call me a doctor is my brother, just because he's so competitive and it like pisses him off that he doesn't have a PhD or a clinical doctorate.
Yeah, the first question I have for you is, how does it feel to be a doctor and to be like better than everyone else?
Ooh.
This is the thing, is that I'm not better than everyone else. And
That's true.
I think what makes a doctorate special is that you go to school for a long time, but you can't stop learning. Like, you're considered an expert of whatever, an expert of, like, I had a doctor in Latin, right? Like, Dr. Chavez.
Yeah.
She had her PhD in Latin, but she was like, always, you have like a responsibility to keep learning, I think, even after your degree, because that's part of your education, is like, how do you continue to learn and grow even once you have this degree? So I don't know, being a doctor is a little
Sounds tiring.
It's just a title.
Yeah, I'm like, wait, can't check a box off.
It just means that I have a responsibility to like surround myself with other smart and smarter people than me to keep learning so that I can help people. That's all.
But it does sound like you are better than everyone else because you're still learning.
No, I'm not better than everyone else.
I'm just kidding. I'm joking, and I'll stop now. What's up? Welcome to the podcast.
Oh my God. I love it. Okay, let's jump in.
Let's jump.
So, Jess obviously is a PT, and I have the pleasure of being her friend, but she's also helped me a little bit with an injury that I worked through. So I have a hip injury, and I don't even know what it's called in the moment, but something's wrong with my hip.
Do you want me to tell you?
What's it called?
A labral tear.
A labral tear.
Yeah.
That's what I have. And it's a funny little gadget. Sometimes it pisses me off and other times I can live with it. And I've seen, right when I got the injury, around the time that I was running half a decade ago, maybe even a decade ago.
Why we should never run.
Yeah, that's what you get for running.
Anyways, I had seen a bunch of different doctors, my primary care, who referred me to different PTs and just a different avenue of people. And I found that it was just like an in and out thing. You know, they were just like, all right, can you do this? Can you do that? Here's a movement to try out. But they were silly things that I was either already doing or just they weren't making a difference. Anyways, when I was talking to Jess about the situation, she was saying, let me check you out, whatever. So she came over and she did this kind of collaborative look into, you know, what I was capable of, things that might have been a little bit more challenging. And it was a much bigger approach to my injury than I had ever looked into before. So I guess my question is, when you see clients, like, how do you approach the situation that most people are definitely not used to in medical field?
Yeah, so I have the fortune of being partially outside the like traditional healthcare system. So when you go to an inpatient or an outpatient clinic, you know, when you're seeing a PT through your insurance, the insurance is kind of the boss, and insurance doesn't reimburse a lot for PT services. And so in that setting, as a PT, you're seeing like 2 or 3 people at a time. Time is really crunched, and there's usually like a million other people around, and I can't even hear my own self think. So it's just a different environment with my own business, Living Fit. I get to go to people's homes, and it's completely one-on-one for about an hour, or however long the person needs, really. But I get to like see them in their own setting. I work for them, not the insurance company or a doctor or, you know, a big PT clinic. I'm working for my client. So, I think one of the most important things is just to listen. Like, people will tell you what is wrong with them. You don't have to get fancy and like, you know, just don't get fancy. They'll tell you exactly what's wrong with them and exactly what they want help with. So I think, you know, looking at everything is connected. You literally start as like one little cell. Everything is completely connected from your tongue to your foot. And so looking at your whole body, asking questions about sleep and what you're eating, and, you know, just getting all the information I can get, full picture to help with a hip or, you know, whatever it is. But outside of the traditional healthcare model, I have the ability to do that, which is really cool.
Definitely.
I love that. I feel like, yeah, that's so rare. Like Caitlin was saying, like we're so used to being like dismissed by a lot of doctors, or like you said, like the insurance just won't cover something. So then it kind of limits your options for a lot of people, which is so challenging.
Yeah. I don't have a good, like, I don't have a good fix for the healthcare system, but it is so broken. So I think like supplementative, is that a word?
Yeah.
Supplementative.
Could be.
Supplementary.
We're making it up.
Whatever.
Might be.
My mom's a teacher, don't tell her.
I'm supposed to be too. I'm like, yeah, it's a word.
They don't teach that word in second grade, do they? But like these other like supplementative therapies or services, acupuncture, like things that can take the burden off of like the traditional healthcare model, which treats people who are sick, I think it's helpful.
Love it.
Massage.
Okay. So as most people know, I'm a little bit crazy. I'm getting a little bit more balanced, but
We're all
we're all a little crazy in general. But no, in terms of the medical field, I definitely have gone through a phase of my life where I was like holistic everything. I'm going to an acupuncture. I'm going to like a voodoo doll specialist. Like I've seen, I didn't actually do that, but like I've seen very creative healthcare.
Yep.
And I'm fine. And then I had a C-section, and then everything went to shit. And I feel like I was forced into more of like the traditional medicine we see in the States. And now I'm kind of trying to find a balance between that. But I feel like in our conversations, a lot of the time, you have such a good perspective on the balance of holistic medicine versus traditional medicine in the United States. So I guess I want to know, like, what is your view on medicine, and how can we kind of like use those different modalities that you were kind of trying to talk about into finding like what's best for us?
I think it's a loaded
question. I know.
I'm reading a book right now called Outlive, which the author is Peter Attia. I don't know how to say his name. He's a doctor. And he does a nice job putting into perspective the like evolution of the healthcare system. And he defines it as medicine 1.0, 2.0, and 3.0. And 1.0 was that like however many hundreds of thousands of years ago, they thought the gods like determined everything. So if you got, you know, an infection or whatever, it was like, oh, well, the gods decided this. Sorry, you're going to die. That's it.
Sucks for you.
Sucks for you. And then medicine 2.0 is that, and we're like in that right now, is that we know how to thankfully treat infectious disease. So, you know, when you have a sinus infection like me and need antibiotics, or, you know, have a blood infection from a UTI or a cut or something, we have medicine to treat that and to save your life, which is amazing. And this book put that into perspective for me. Like, the medical field and system saves people's lives, because that's what it's meant to do. Medicine 2.0 is like medicine for sick people. Medicine 3.0 is healthcare, which we don't like. The model right now is sick care, and we're not very good at keeping people healthy. So there's a lot of work to do. And I think the people who work outside of insurance, massage therapists, a lot of acupuncturists, I don't think you can go through insurance, maybe some you can. A lot of physical therapists, personal trainers, health coaches, group fitness instructors, like those are the people who have such a wide reach. Like if you're seeing 20 people in your class, you have so much more, you're reaching so many more people than I reach in a day, and so like talking and leading by example of living a healthy lifestyle is so important. But there's still so much work to do and figuring out what works. Like, you need a balance, you need the medicine when you need it, but then also you can't just rely on medicine. You need to like have some good healthy habits, lifestyle habits, and that's where there's still so much work to be done.
I feel like that makes sense in my brain though, to categorize it as tier 1, tier 2, tier 3, like intervention.
Before I read the book, I was like, I hate medicine.
It's hard, like, not to.
These doctors are pushing me to have an induction, blah, blah, blah. And like, but like they're evidence-based. They're doing their job. That's their training. And so I have to like, I really try hard still when I go to the doctor to be like, they're just doing their job. That's their training. And it's up to me to go and seek out people who are helping people stay well.
Yeah.
But I feel like that would be such a systematic solution, is to make it more collaborative and have more of like a network of doctors, like you said, personal trainers, like dietitians, and all of those people, and they refer to each other. So that way a doctor is not just prescribing medicine, because that is technically what their job is. Like they're not doing anything like quote unquote wrong. Some are, but not in general, not
There's
blanket statement. Yeah. But I feel like also because it's such a business, such a bigger conversation. So complicated.
To answer your question, it's just like it's an internal battle, and you kind of just have to like, I don't know, stay informed and keep advocating for like what you're feeling.
No, that makes sense.
Yeah. Can we talk?
No one knows your body better than you.
Oh, that's a good
never
point
forget
too.
that.
Yeah, I feel like I want us to talk about that a little bit more, because advocating for yourself, especially as a woman at the doctors, can feel really daunting, and like we're not used to doing that. We're kind of taught to just be like, okay. And I definitely have had times where I try to advocate for myself and the doctor just like brushes me off even more, tells me I'm neurotic, and like sends me on my way. And that's so frustrating. So like, I don't really know what the question is there, but any tips for like
advocate for
getting
yourself.
the balls to advocate for yourself?
Talk to people around you and like learn from their experiences. Talk to your friends, talk to your female family members. And like if if your mom or aunt or whoever has a history of breast cancer, no one offered me a breast exam at my last physical. So
that's weird.
Right?
That should be happening.
So I went and bitched to everyone, and I was like, can you believe no one has to touch my boobs?
Right.
No, Jess is a bulldog too for healthcare. She actually was the reason I changed my primary care, because I was saying these complaints to her, like after having a baby, you go through all of these weird changes, and I was concerned, and I felt like I was being kind of just like you're saying, Amanda, like rushed out of the room. Like, we got another appointment coming. You're fine. It's postpartum. Like, you're bald. It's okay. And I was like, what is going on? And so it is like talking with your friends and being like, is this normal? And then maybe giving you a different resource. Like, my doctor doesn't do those things. Like, she gives me time. Here's her name and number, like, and just talking it out, maybe seeking different doctors is super helpful too.
Mhm.
So I
Mhm.
feel like having that conversation with people instead of being like secretive.
Totally.
All right.
Oh, sorry. Would you have any like questions that maybe you would ask maybe like the first time you see a doctor or something, like almost kind of like interviewing a doctor, especially for like something big, like okay, you're choosing like your OBGYN or something, like you want to make sure it's a good fit.
You know what? I think honestly, the way that you are like treated and how you feel
Yeah.
during your appointment is going to be like your experience is worth 1,000 words.
Yeah.
Um,
Like trust your feeling and your gut
yeah, trust
with
your
it.
feeling. Like if they spend time with you, if they sit and aren't on their computer the whole time, which they have to write notes
Yeah.
during the appointment. But like when you're talking about something important, like being bald, after having a baby, or like, whatever it is, if it's something important to you and they're just like typing away, not looking at you, they can do better than that. So like that might be a vibe that you're like,
Yeah.
I need someone who like can manage the personal skills a little better, or if they don't do a breast exam, like I'm in the market for a new primary care.
Yeah.
Yeah.
Um,
Yeah, that makes sense.
I think the vibes you get are more important than like any question that you could
Checklist.
ask.
Yeah.
I
All
love
right.
that.
Going into that, I feel like this is a much bigger topic, but one of my questions was kind of like, how do you find a good healthcare provider? And it came after my thinking about these past now 3-ish years of everything in the world got shooken up because of COVID. So I'm curious as to kind of like, what was the transition before COVID, during COVID, and after it? Are we at a better place from COVID because it kind of like changed everyone's perspective? What did it look like in the healthcare setting? And how did it kind of change up that whole setting?
COVID rocked everyone's world. Even, like the smartest physicians that I knew or know were rocked. Like they had no idea what was going on. I will say one awesome thing that came out of COVID is that the healthcare system is much more like able to do telehealth and video calls, or like send me a picture. Like before they would be like, you have to come into the office, and it's like, okay,
You're like, can we do this in an email?
yeah.
Yeah.
Like, yeah.
Literally.
And I think they're better about that now. You can get a telehealth appointment hopefully the same day, if it's not something that you like have to go in and have hands-on or something. So I think that is a really cool thing that came out of COVID to make everyone's lives better and just more efficient. Like it makes the healthcare system more efficient if the doctor can call you for 5 minutes rather than
Yeah.
take a 15 or half hour, slot of an appointment. So that's a good thing that came out of COVID. I think the other good thing that came out of COVID is that probably the educational systems that train medical professionals are thinking about how can we prepare people for this sort of thing, even if we don't know exactly what it is. I had been out of school 3 years, like 2.5, 3 years when COVID hit, and we were not. And I like led the physical therapy on a COVID unit. I opened up the COVID unit with a occupational therapist in the inpatient setting I was working in. And I remember looking at her name was Nicole, and I feel so connected to her forever. I don't talk to her very much anymore, but because we like lived that nightmare together, I
Trauma
like,
bonded.
Yes, where our hearts are attached. I think of her all the time. But I remember looking at her being like, we are in our 20s and we and these other like 60-year-old physicians who have done medicine forever have no idea what to do. Like no idea, right? We're wearing trash bags. We're wearing the same mask for 3 months. Like we would try to discharge people home and just print out the CDC guidelines that said basically we have no idea how long this is contagious for, but like you need help getting out of bed, so like hopefully someone can help you and good luck.
Oh,
Like
yeah.
That's so awful.
just like printing what the CDC was saying because that was the best that we had, even though it was so vague and didn't really answer any questions.
Ugh.
So I feel so thankful that there are vaccines now and there are medical therapy. So if you get COVID and you're high risk and you need treatment, they know how to treat it now. Medicines exist because not that long ago, like if you got COVID and you were high risk, we didn't have anything to treat these people. They were just dying. So I think, the healthcare system did like come together to treat these sick people. And I think people learned a lot in terms of like pandemic preparedness, medical equipment supply, like making sure you have enough masks, gowns. So I mean, COVID was crazy. COVID was crazy.
Yeah, I
It
know.
was.
Well, we got telehealth out of it, so
We got telehealth out of it.
I'll take it. I
Down
will
for
admit,
that.
I love telehealth
It's
because
great.
I'm like, let me just take a picture of my
Yeah.
weird thing and send
Of my
it to
weird
you.
I mean, yeah, if you don't have to go to the doctor's office, like, sign me up.
But I feel like we're even back to where we were almost like in terms of with doctor visits, like I'm just one of a million a day, and it's just like it's kind of sad too that now we're just back in the shuffle and the hustle of everything, and it's like, come on, can't we learn something?
I know. I know.
Oh my gosh. Okay.
Oh, man.
Before I move on to you personally, I'm going to ask you very intimate details about your life. Shoot. Mandy, did you have anything more about like the healthcare system before I move on?
Let me just make sure from the notes that we took. I don't think so. I think the only thing more about like your work in general, was something that you had in your bio. You said that you have like throughout your career and working in different settings and with different patients, you've come to understand that, like through whether it's like dance and movement or more of like your scientific side of movement, that like there's a lot in common there and there's like no perfect solution for everybody, but like you can always help people find progress. So I'd love for you to expand on that because I feel like that just takes a little bit of weight off of everybody's shoulders in terms of like there's not one thing I should be doing, so I don't need to put all that pressure on myself. I just need to find whether it's the right practitioner or the right modality.
Totally. So I think like in sports, you can like shoot a goal and get a goal or shoot a basket and you win the game. Like there's a win. You won the game, there's like a clear outcome. But with like performing arts, I don't know, it's like I come from a dance background and I didn't really compete in my later training. So it was never good enough. Like we were always striving, like we were being pushed to like strive to be better because there's no such thing as perfection in dance, same thing with running. I think like you can always be like working on not that I like to run, but like you might win a race or something, but like it's never enough. You're always trying to like improve your form and reduce risk of injury and get your time down and things like that. So I think human movement is just like that. Like there's no like huge win that we're going for. We can always just like keep working to meet the needs of our body and our life. and it's never going to be perfect, and that's okay. You know, your needs, your movement needs change. So like my movement needs now are so different than a couple of years ago. You know, a couple of years ago I was, you know, teaching HIIT all the time, and I loved high intensity interval training, and I was lifting really heavy and doing Zumba. Like I do a little of everything, but my everything is so different now. Now I have a sinus infection and a toddler, and I'm like, I should be doing yoga, but I'm doing like spin and some like core, you know, full body strengthening and stabilization, a lot of breath work. And I'm sleeping. Like your needs change. And then, but I still lift heavy because you got to be able to lift the stroller from the ground.
Totally.
And I don't have a lightweight one yet. So I got it. So I'm doing my deadlifts to prep for the stroller, you know. But then, you know, when you're retired, you're like moving to golf and pick up your grandkids and not fall. So your needs change. And I think just like embracing that is where we need to
I
go.
love that.
Yeah, I love that
it's
too.
like a mindset for your whole life. Like I love the idea of not working to like clearly that I'm working through this right now, but like I love the idea of like living not to check boxes off and like, okay, now I did this, now I'm on to something else. It's like just going with the flow and like going with what feels good, and nothing is supposed to be like one and done, you know, like just move the way you feel good. And I think that that's kind of like a good perspective that you have on life. And so getting into this next category of mine, I always tell people, and I was telling Amanda, like you have such good boundaries, you have such good kind of like work ethic, you can like kind of find a balance, or at least like work towards finding balance pretty harmoniously. So what are 3-ish or more like things that you do throughout your day or the way that you view life that we can all steal from you and do daily as well?
Oh, well, not perfect. So I'm always working on these things myself, but that's a great question. I would say sleep. You need more of that.
Yeah, I'm working. Okay.
She chugs her coffee.
Like every month. I see a picture on Instagram of Kaylin at 3 or Annie at 3 a.m. and I'm like, oh my God, they need
party all
sleep.
night.
But like also being accepting that like that's the season you're in. Like you're gonna sleep someday. You will.
Yeah.
So just be graceful with yourself. But sleep is like generally important. These are super basic. You could look these up on Google, but they're legit. Water, drink water, move. I try to move every day, even if it's just a walk outside or like get down on the floor and roll around.
That's a good one, actually.
Yes.
Babies do it. It's so like it like resets your
good mentally, and also like that works your core.
It works your core.
Gotta get up somehow.
Right?
Yeah.
Yeah.
But also, can we note that none of those things, I mean, it could cost money if you're joining a gym, whatever, but you could do all of those things without spending a dime. So thank you for that.
And then laugh.
Sorry, you go.
Yes, that's all.
Yes, belly laugh.
And then laugh about how ridiculous you look.
That is a good one. Yes.
That's such a good one.
I love
That's
it.
what I would say. Yeah.
I love it. So live, laugh, love.
Live, laugh, love, and roll. Live, laugh, love, roll. Title of the episode. There we go.
Yes,
but it's so true. I feel like you hear these types of questions asked on a podcast, and every time they're like, well, you know, I have my greens powder every morning, and that literally changed my life. And then also this ice roller that also changed my life. And
a good morning routine. I'm going to tell you right now, I have no morning routine.
I was actually asking that personally because I don't know what I'm doing in the morning anymore, and I feel a little lost.
No, sometimes
can we talk about that actually?
Yeah, what should we be doing?
I'm the wrong person. Mandy, what do you do in the morning? I'm the wrong person to ask.
I was literally this morning, I had set an alarm and was told myself before I went to bed, like, okay, I'm going to get up and I'm going to do just like a home, like a YouTube yoga class in my living room, and then move on with my day and start somewhat of a morning routine. And I woke up and I was like, we're absolutely not doing that. But then I just laid there for a while and was like, well, this doesn't really make me feel better either. I'm not sleeping. I'm not doing anything productive or really enjoying myself. I'm just thinking of like, what should I get up and do right now?
That's my life story.
And then I got up and I had coffee, and like then all of a sudden like hours were gone out of my morning and I didn't really do much. So I don't know.
Yeah.
Happens. It happens.
Yeah, I don't either. Someone let us know what we should be doing in the morning. Clearly we're all lost.
And like I don't know what your daily schedule is, but I feel like my daily schedule is different each
I was
day.
gonna say that. So I think your morning routine can change.
Yeah.
Yeah.
I
Like,
think
so
that's
maybe,
what's challenging.
okay, here's like a productive thought, is that maybe we plan our morning the night before, but like it could be different every morning.
Mhm.
Yeah.
Tomorrow, I don't have somewhere to be early, so I can like wake up whenever and make Annie pancakes. Or like I do have somewhere to be tomorrow morning, so I just gotta like get up and go.
Yeah.
Mhm.
Like at least having some like
Thought into
thought,
it.
Yeah.
it will feel a little better.
Yeah. I like that idea. You just have to follow through when your alarm goes off and not be like me.
So hard. It's so
It
hard.
really is. Maybe journaling in the morning. Can we get that out of the way? Over journaling.
I don't have time to journal.
Journaling
No.
was 2022. Over it. If you
I
journal,
tell myself all the time that I'm gonna journal more, and then I like flip open my journal and it's like, well, that was 3 months ago the last time I opened this, so damn it.
Don't you have like a 3-minute journal or something?
I have a 5-minute journal that I actually do really like.
I could do
Okay.
3 minutes, not 5.
It doesn't take me 5 minutes because honestly, I write down a lot of times the same shit. But it kind of is helpful, and I normally like really don't finish each. So it has a morning section and a night section. And so like the morning section is just kind of like, what are you looking forward to from the day? What could make today awesome? What are you grateful for? Something like that. And then the nighttime was like, what was one good thing from the day, and like did you learn anything today or something like that? And it is like a nice book ending of the day, but like if I do the morning one, I always forget to do the night one. If I forget to do the morning one, then I'm like, okay, maybe I'll do the night one.
you know, you're doing great, sweetie. Okay.
Thank you. And I don't even have a baby, so what's going on?
We're not trying to be perfect.
No.
So going on something that I do think that you do pretty religiously. You do work out like pretty daily, right?
Yeah.
Is that an assumption or is that true?
I would say like anywhere from 3 to 6 times a week.
Okay.
Yeah.
I like that range.
Depending on
Great.
the
0 to 7 days a week.
I would say 3 to 6.
Okay.
4 to 6.
Hey, Po, in that train of thought, do you think that there is kind of like a one size fits all modality? And we've kind of touched upon this, but like, should everyone be walking for 30 minutes? Like there's like I don't know who says it. I'm just going to say the CDC because they rule our world now, but like everyone should be getting 20 minutes of movement a day, and it should look like this, this, and this. Is that true?
So there are some like basic recommendations that are put out by the CDC, the National Institute of Health, the American Heart Association, American Cancer Association probably agrees. Like there is agreement that ideally people adults get a minimum of 150 minutes per week of like moderate physical activity.
Okay.
That could be like, building a lobster trap tree in your front yard. Like
who has one of those?
It's like the activity can be, it needs to be moderate, but it could be gardening. It could be pushing a stroller up the hill, like, whatever it is. It could be on the Peloton. So that's kind of like everyone's in agreement about that's like the minimum to shoot for in a good week. Like if you're sick, that might not happen, or if you're pregnant or whatever, if you're too stressed with work and you need to sleep, like maybe you prioritize sleep over your workout that week, so, but that's like, ideally what you would shoot for. And then, the other like thing people are in agreement about, and this is like pretty evidence-based, is 2 days a week of resistance training. And it doesn't have to be for a long time. It could be 20 minutes. I don't really say how long it needs to be for. And I think, with a lot of my clients, I lump that into the 150 minutes of moderate physical activity. Because if you're lifting weights and, doing jumping jacks in between, like that's moderate physical activity. So those are kind of the like guidelines, but make that totally personalized. So as I said, I was doing HIIT and lifting really heavy and doing Zumba. And now I'm spinning and walking up hills, pushing a stroller and dragging a dog. And, sometimes I'll do kickboxing because I like that.
You're so
Poor
angry.
soul.
But it can be totally personalized. Doesn't incorporate like mobility or flexibility, which I think is so important. And those two things are different. So flexibility is how your muscles stretch, but mobility is how your whole body moves and how your joints move. So I think, differentiating those things. But again, that could be like rolling on the floor, or, like that cross body stretch. Like that takes like 2 seconds, but just like get that into your day when it fits in. And no, there is not one size fits all. And again, it's never going to be perfect. You just, you do what you can do, and it changes through the seasons of your life.
So we shouldn't be doing 75 hard.
Okay, I don't know who has time for that.
Well, that's actually very true.
Literally, though.
Seriously.
I don't know.
Well, there's a reason why a man designed it, and
That's yes.
If you're in that season of your life where you have enough time to do it, I think it can help you build some good habits, but like you can't do 75 hard your whole life.
Yeah.
I don't think. I think that's impossible.
I could not. I couldn't do it one day.
But I will tell you, okay, here's the one size fits all thing.
Ooh.
Have you heard of the blue zones?
Yeah, I watched the documentary.
Did you?
Yeah.
Have you heard of the blue zones, Mandy?
I don't think so.
Okay.
Tell me,
Go
what are
check.
these blue zones?
I need to go.
I think it's so like hopeful. Okay.
Okay,
It's
give me some hope. Come on.
Okay.
She leans in.
Yeah, I'm taking notes.
So it's all of these places around the world that random, like Japan, Greece, California. These people do not come from the same part of the world at all. They have different cultures, different DNA, like totally different. But they all have these like little cohorts of people that live well into their hundreds with like little to no chronic disease. Okay. Which is not most of America. America is riddled with chronic disease, obesity, diabetes, heart disease, cancer. Like, we're not doing great in the States, to be honest. Okay. But there are these places that people are like living their best lives. They're moving well, they're eating well, they get to enjoy their great grandkids, and they feel good while they're like on the floor playing with their kiddos and grandkids at 100. Like, it's incredible. And they've looked into like what these people are doing that's similar. And there's 9 things, and I'm I'm not gonna be able to name them all. Excuse me, but the gist is that they eat like whole foods, not packaged crap. Some eat meat, some don't, but there's like a lot of beans, a lot of vegetables, a lot of fruit, all the things that like make sense that are good. They move naturally on and off the floor, walking up hills to church, blah, blah, blah. They drink wine, 1 glass a day, like every day. They are really strong, right?
I'm waiting, girl. Counting down the days.
This summer. They have good friendships, like good social connections, and they're
important.
And that's like the gist of it, but it's like very wholesome. And I just think it's like, that's what we should be striving for. These people aren't in like a crazy controlled science experiment. They're just living their life, and they're obviously doing a fucking good job because they're doing it.
Yeah.
They live to 100 and they're happy and healthy, and
yeah, they're not in a hospital at 100 either.
Yeah.
Like moving around. It is really good documentary. Is it called Blue Zones on Netflix?
On Netflix?
Yeah, it's
On it.
100.
Okay.
Like blue zones or whatever. If you search blue zones.
I'm going to watch that.
So inspiring, because I don't know, I was getting like in PT school, it's disease focused and whatever. And it's like kind of depressing. Like,
Of course.
how can we make this better? But I think that blue zones are so hopeful that like these people live a really wholesome life and make good choices. And they're not the exact same choices. It's not one size fits
No.
all, but like there's trends. So blue zones.
I love that. And I think that kind of goes back to what you were just saying too, or kind of like a theme that's sort of been woven through this whole conversation when you're talking about movement is like allowing your routine to fluctuate with the different stage of life that you're in. But like that also goes back to like, okay, what's your goal of moving? Like obviously when we were like in our early 20s, I think for a lot of women, it was, yeah, a ton of HIIT and all this stuff because you're trying to just make your body as small as possible. And then as you get older, you're like, okay, well, I want to be able to like be on the floor with my kid or keep up with them. Or when I'm older, I want to be able to bend over and tie my shoe by myself. And like focusing on just your quality of life can be so freeing and like, oh, well, that makes that choice really easy. And I'm just going to go do this thing instead of like giving it all up or doing the whole extreme everything, you know?
Yeah.
Yeah.
Love that. Giving us
Okay.
hope.
Giving us hope. Let's go on to the hope conversation, the hope topic, the little light in our lives. So you had a baby 19 months ago now.
Good thing you
Queenie.
keep track because
Yeah.
I'm still
Well,
like
it's
18.
1 month more
What
than
day is it? Oh my God,
Yeah.
she is.
Yep, 19 months.
Dang.
Yep.
Ah,
Which is crazy. So my question, I guess, is like, how has these last 19 months been different for your outlook on life? How has like obviously so much has changed, but what are like the big things since having Quinn?
My God, Quinn is so fun.
It's so fun.
And I feel so lucky. Well, the biggest thing is you're back in my life.
Here I am.
When we were pregnant, my mom worked with Caitlin and was like, eventually she would, for years, she was like, oh, I saw Caitlin. She's so cute. Yes, I loved Caitlin. But like, I don't know, we just like lost touch and whatever. Life happens. And then finally my mom was like, you know, you guys are both really pregnant. You should go for a walk.
Oh.
Okay. Well, we did. And so my like reconnection with Kaylin has been such a blessing the last 19 months. Because our
So
girls
nice.
are 3 weeks
Cool.
apart and we just like, I don't know, live the craziness together. Like, I'm not gonna tell you which one, but one of us, maybe both, you know, use breast milk and the eggs one morning.
You do what you gotta do.
You know what? You exactly.
Whatever. And you'll never know who it was.
Oh my God, I'm like, that was me. It's
Honestly,
great.
like
Oh my gosh.
that feels helpful. Sometimes you run out of milk.
Or Quinn. It wasn't for my husband or anything.
I don't remember. Probably was for the whole fam. I'm like, let's go. Scram beach for everyone.
You're like, it's fine. Just a quick squirt, a little splash.
Back then they were drinking like just breast milk or
Yeah.
formula. So like, what if you didn't have milk in the house?
Yeah, exactly.
And then water isn't the same.
No, it's just easy.
So whatever. We just like
I
go
support you.
through like the craziness together. So that has been a real blessing, is like finding people who are going through the same craziness.
It's wild.
But then I don't know, I think I feel like I'm working too much right now because life is just like crazy. So that is always a hard balance between work and Quinn and my dog Boone and my husband Connor.
You're like, and
And also that other guy.
they're always at the end after the
That's
dogs.
what started this all.
Yeah.
Fair enough.
But I don't know, I think like it never feels balanced. It's either like I'm working too much or like I'm not working enough, but I do get to like spend really good quality time with Quinn and Boone when they need me, like when she's sick or whatever. So it never really feels all that balanced, but I don't know, it gives me good perspective. Like when I'm at work, I feel like lucky to be there and like I'm able to help people, use my brain, but I'm so excited to go home. And then when I'm having like a really crazy day because Quinn has taken out everything in the kitchen like 9 million times and I'm just trying to cook something like a simple or heat something up, she takes everything out of all of the cabinets.
Yeah.
Multiple times.
Yeah.
she just keeps finding stuff. I can't walk on the floor without stepping on something or tripping or slipping.
Yeah.
So like, then there are moments that I'm like, oh, so, I'll be a better mom when I get home from work. I need to go to work, come home, refresh, so I get the best of both worlds, I think, but it never really feels like I'm balanced.
Yeah.
I feel like that's kind of refreshing to hear also though, because I feel like that is a fake thing that people are selling, that like you just figure, find the balance.
Yeah.
Like I think the scales are just going to be flip-flopping
It's
all
like
the
this.
time
Yeah.
and you
It's
have
true.
to just
That's
roll
what
with
it
it.
Yeah.
Yeah.
All right. One more question before I move on to rapid fire.
Okay.
I know I did it last night, so it wasn't planned.
She did it at 3 a.m. with Annie.
Love
Yeah. Okay. You started a new business also this year. You kickstarted it. It's always been something in the works, but really you kind of like put it on this platform.
Mm-hmm.
So let's beef yourself up. Like, what is it? How can we get in touch with you? All of the good stuff.
Thank you. So I'm the owner of Living Fit, and I started this business with a new baby, new business. Again, crazy. Like there's no balance. Yeah, it's crazy.
Badass though.
But it's a mobile physical therapy and wellness practice. So I get to go to my clients' houses. I keep it really local because I schedule like 15 minutes in between people. So if I can get to you in 15 minutes, I'll come to your house. But if not, then
It's a good way.
let's email or do a virtual or whatever. But best way to reach me is probably email. And yeah, it's just, my business is really to help people like feel good in their bodies, based on what their goal is, Manny. Like you said, like, is your goal to get off the floor with your grandkids? Or I don't really see athletes, I don't really see kids, but otherwise like general adult, it's kind of my jam.
I love it.
Yeah.
Can we follow you on Instagram too? Which Instagram would you like us to follow? Because you have a couple, don't you?
Well,
all of them?
Horrible on social media.
Aren't we all?
I don't post anything really, except
I go through
my
phases.
dog and my kid.
Yeah.
It's hard. So
hard. It's a whole other job doing it.
yeah, we can link my business one.
Okay.
The handle is probably at Living Fit. But we can
We'll look it up.
Link it.
We'll link it in the notes. Yeah.
In the show notes.
We'll link it in the show notes. Okay, fabulous. And I will say from experience, it's definitely a different experience working with you than other PTs and anyone in that realm of medicine.
And I don't know it all. So if
Living Fit LLC.
Oh,
follow.
Thank you. Sorry for not posting anything. Someday in another season or something. But you can reach out to me through there if anything comes up. What was I just saying?
I forgot.
All right.
Oh, if I don't know the answer about something or can't help you,
yeah,
I'll find someone who can, because I have a lot of like much smarter people around me.
She's so humble.
Dietitians that I love, and chiropractors, and lots of good people. So if I can't help you, I'll find someone who can.
I love it. I know. I was like vent to her things, like just venting, and then she's like, "Here's your answer," and I'm like, "What?" I was just complaining, and she like,
"Thank you so much."
Like, wow, okay, thank you. Are you ready for rapid fire?
Ready.
Is there anything else, Amanda, that you wanted to ask before I move on?
No, that was lovely.
These are so random. So
I love it. I'm excited.
I'm excited too.
We were talking about, most of them don't.
Oh God, I hope I know the answers.
I added one to the bottom, but I didn't really read the rest.
Ooh, okay, perfect. Okay. This is about you dancing.
Okay.
Because this is how much I don't know about dance. Would you rather dance to 2000s hip hop or 2000 boy bands?
Boy bands.
Ooh, nice.
Into it. Were you NSYNC or Backstreet Boys?
Sorry, we're like,
you know what? I was Backstreet Boys back in the day, but honestly, I don't know. Now it might be insane.
Yeah. Except we're canceling Justin Timberlake, which is a deeper conversation that we need to have.
Wait, why?
Because he was a terrible person to Britney Spears.
Okay.
And just
Janet Jackson, his wife.
Yeah.
Okay. I live under a huge rock.
But also, we should definitely more seriously cancel Nick Carter too. So both sides not looking good. Lance Bass. We are fans of Lance Bass. JC Chazé, an unproblematic king. So
King.
in sync.
Okay. Group
Anyways.
fitness or solo workout?
Ooh. Honestly, group fitness, because I haven't done it in so long. I've been solo
Okay.
working out in my house since COVID for a long time, and I miss the group fitness is fun.
Yeah.
Mandy knows. So
It
it's
is.
so fun.
It is. Okay. So this is so random. If you haven't caught on yet, Jess is a vegan, but she also is like loosey-goosey with it sometimes.
Totally.
Like it's funny because I'm like a strict vegetarian, but like I eat anyways.
I would
So-
say I'm 100% vegetarian, but
But
if
you like accidentally had a piece of meat one time and you're like, oh, it was so funny. I bit it and it was like a piece of chicken. And you were like telling the story like it was funny. And I was like, if that happened to me, I would have sued.
We'll sue your ass. See
I'm like loose on the cheese. Oh, because like if you go out to eat and there's cheese and risotto or something, like
Yeah.
what are you gonna do? I don't cook with it, but what are you gonna do?
Okay, so this question goes to that. If you had to eat a whole block of cheese or a half a steak, which would it be?
Oh, cheese.
The whole block?
Yeah, because I think so. I probably
Okay.
wouldn't poop for like
Yeah.
7 weeks. I stopped eating it to begin
Oh, that's
with.
good.
We never hear from her again.
If you're having issues down here going to the
Ooh.
bathroom, I'm gonna tell you the first thing you should try getting rid of is cheese.
That's hard though.
Just from personal experience, that my education didn't teach me that. That's not PT. I'm just saying.
No, it
Like
makes sense.
50% of adults are lactose intolerant.
Oh,
Because
really?
once you're not a baby and you stop growing, like we should be done growing, you don't need
But I'm not.
dairy.
No, I know. I know it's true.
But
And
it's
it's kind of
so
gross.
good.
Soul needs brie.
But now, so I've been vegetarian so long that now I do not want to eat an animal. Like that is,
Yeah.
it
Yeah.
disgusts
Yeah.
you.
Yeah. It is weird how like, your
So
brain
yeah,
is like-
definitely
Weird and
cheese.
gross.
Okay.
Okay.
One thing you can't leave the house without.
Chapstick.
I was gonna say your water bottle. You have like your security bottle.
Oh yeah,
all
I
the
don't
time.
drink it though.
Yeah,
This
no,
is
I know
the
you
best
don't.
water bottle though. A Walla.
Okay,
Where do you
yes.
Target or Whole Foods.
Everybody has
It's-
these.
So
Really?
it has a straw. You can.
Wait,
Oh.
okay. Can I tell you a story as to why I feel like I need one of these now? So yesterday, my little sister was over and I was drinking out of this one with like the open straw. And she told me that her best friend like had it next to her bed and in the middle of the night went to take a sip, felt something in her mouth, spit it out, and there was a spider hiding in the straw 'cause it's like cold and dark.
Ew.
So I need one of those because the straw's covered.
That's cool. I
And
didn't
for
know there was a
germs.
straw.
And for germs.
Yeah.
You can also
PSA.
like out of it, but I spill it on my phone
Yeah.
every time.
Okay. Now we're all gonna go buy that. You're an influencer now.
I don't
Influenza.
drink it out of it.
No, you definitely don't.
Yeah, I've been drinking my Starbucks. All the
Yeah.
time.
It's an accessory.
Some chopsticks make my lips more chapped.
Mm.
Yes.
Yeah, what's your favorite one?
Thanks for asking. Dr. Bronner's.
Oh, I didn't know they had. Oh, maybe I
Oh my
did.
God.
Are they good?
Yes.
Okay.
Where do you get that?
If you put enough on, it looks like lip gloss.
Perfect.
I know. Amazon.
Amazon.
Perfect.
Yeah, like everything.
Sorry, I'm really infiltrating your rapid fire. Carry on.
Speak fast. I'm kidding.
Like it's supposed to be fast, but also I need answers.
Oh, wait, we need more. Can you send us a link? Favorite day of the week?
Saturday.
Okay.
My least favorite is Tuesday. I
Did you
feel more
work well?
strongly about my least favorite. Tuesday is just like,
The pits.
oh, it's not the
Yeah.
beginning. There's so long to go.
Yeah.
I don't know.
No, at that.
Tuesday's tough.
Okay. Would you rather wake up and go to bed early or wake up late and go to bed late?
Wake up early and go to bed early.
Okay.
Mm.
But I feel like you go to bed kind of late now.
Kind of by accident because I'm trying to hang out with my husband.
Yeah.
That's why.
Okay.
But I still wake up early.
Okay.
So that the
So
late,
you
so the
are.
late doesn't work for me.
All right. What is one piece of advice that you teach Quinn that you want everyone to hear or know?
Oh my God.
I feel like you guys, your whole family had like these one-liners that just like punch. You're like, what?
Well, Nana told us when the girls were little, they cry. That's how they get their energy out.
Okay, that's good.
If your baby's crying at home, Nana had 6 of them, and she said they just cry
Ooh.
sometimes. It's okay.
Oh my, well, our girls
They
were,
cried a
they
lot.
were,
We have a
they
lot
were
of feelings.
tough babies, but they were,
They needed a lot of support.
yeah. And everyone else's babies were like easy from day one. I'm so happy that both of our babies will just
They
needed
needed-
extra love.
They needed a lot of help.
Yeah.
What is one thing? I tell Quinn a lot that she's never alone,
Oh,
because I think being alone can be really scary. I don't want to be alone. I like being with you or Connor or my dog. So yeah, I tell her a lot that she's never alone.
I love that.
I'm
That's
with
so
her forever.
sweet.
I made her.
Yeah,
I'm in there.
I love it.
So, yeah.
Ugh. All right, Mandy, the last one's yours.
Can you read it? I don't have it up anymore.
I didn't want to, if you want to take it home or something, you're like, no, I'm
Take
good.
it away, girlfriend. It's all you.
All right, a piece of advice for someone about to start their own biz.
Go for it. Just
Ooh.
do it.
Yes.
Right, Mandy? What do you think?
I'm right there with you. Do
Go
it
for it.
messy. Do it.
It's never gonna
Like you're not doing
feel
the right thing and like, I don't know.
there
go
are a
for
lot
it.
of really freaking dumb people running businesses
That's true.
and doing a shitty job, and
Making billions.
Yeah.
yes, it's like you can do it.
It's
Okay.
actually so true.
We get a lot of like DMs and stuff from people saying like, oh, I want to start a podcast, or I want to do this or that and this and that. And so that's such good advice. Like very simple, easy. Go try it.
Just do it.
Just do
Yeah.
it. You can find resources for literally anything on the interwebs.
I
You'll
love it.
never like feel ready, I don't think.
Mm-mm.
I didn't. I just
Yeah.
did it. No one actually has any idea what they're doing in life. It's everyone's first time, or they
That's
forget
true.
if they lived before, so
Yeah.
it's no one has any idea.
Yeah.
Everyone's
No.
just faking it,
I love it.
True that. What a way to end it.
Yeah, that was
Some
perfect.
inspiration.
That's all I got.
Wait, what
What?
about your rose and thorn?
You're really looking forward to it.
What's
We
your
usually
rose and thorn?
do it
Tell us.
when we have guests, but we can totally do it. What do you got?
All right.
You've been thinking about it?
No, but
She's like, hold on, let me think.
She's like, I have to ask you guys something.
Okay, rose. No, let's start with thorn.
Okay.
My thorn is a sinus infection.
Yeah.
I'm in medicine 2.0. I'm on antibiotics for the second time, hoping that they will kick this.
Ugh,
But thankful they're working.
yeah.
Rose is that Christmas is coming, and I think I'm gonna get to see a couple of friends this coming week that I don't get to see a lot. So
Okay.
I'm really excited about that.
That's so great.
Yeah.
I love it.
What about you guys?
Mandy, you want to go? Do you have anything?
Sure. Okay.
Hit me.
Okay, my rose is that yesterday I supported another event planner at their event, and there were a couple other people like helping on site that day that also have their own like small event businesses. So it was like really awesome to connect with them, and like we all vibed really well. So I felt like I got to do some like good networking, which, as I'm sure you know, sometimes when you're starting your own business, it can feel a little bit like progress and then like
So
and then so it felt good to like, all right, we're doing some stuff.
people are like, how long have you been doing this? And you're like, 2 weeks.
Yeah. literally they're like, so like what kind of events do you do? And I'm like, mostly helping everyone else with their events. If you know anyone,
Yeah.
my thorn is, I don't know. I'm tired all the time. And like, when will that stop? Never, because like I don't even have babies yet. So
It's a real.
yeah.
Okay.
Yeah.
My rose is that I am actually liking our lobster trap trees in the front of my
I
house.
love it.
And usually all I do is complain about Chad and his things because because I do. It's just our relationship. I love him dearly, but like it's just part of who we are together.
Your thing.
I complain about all of his like crap and he just gives it back to me. Or he brings more crap home.
Yeah.
But I actually am liking it this season. I'm liking the crap. So I'm embracing the crap. And I think my thorn is that my hormones are haywire. Some days I think I'm actually like mental. But I think that knowing it is hormones is definitely helping me get through those hard moments. So
Mhm.
Being
So
pregnant.
funny.
seriously.
There's this one woman that I know at least follows our podcast Instagram. I don't know if she listens. And she lives in the South Shore, but she like reposted this reel about all of the best lobster trap trees in Massachusetts. And I almost messaged her your home address to be like, go look at Caitlin's.
That is hysterical. Oh, I
Your
gotta
guys is the
find
best
it.
because it's three-dimensional.
It is.
Other people just do flat
Oh,
ones.
that's true.
Lame.
And I
That's a
prefer it.
cop out.
Yours is way better.
Yeah, it
Yeah.
is. It's great. It came from, if I come from the right side, I don't like it, but if I come from the left side, I like it. So it's gotta come from one
Okay.
side of town, don't look
You know what you have to do.
all the junk in the yard that I'm mad at Jack. Now I'm mad at you. No, I'm kidding.
I love it.
Goodness. All right. Well, thank you so much.
Thank you
For
guys
coming
for
on.
so fun.
All right.
So fun.
See you guys later.
Appreciate you.
Bye.
Okay.